The United States Navy announced it was sending a hospital ship to Greenland. There was just one problem. Nobody in Greenland asked for it. And as of the moment of the announcement, both of America's hospital ships were sitting in a dry dock in Alabama. But the real story here is not about a boat. It is about what that offer reveals concerning a geopolitical struggle that has brought the NATO alliance to its most serious internal crisis in decades. And the question that every world capital is now asking, what does the United States actually want from Greenland, and how far is it prepared to go to get it? To understand what happened on Saturday, February 21st, 2026, you have to understand the year that preceded it. The hospital ship announcement did not arrive in a vacuum. It arrived at the end of a long escalation that began in the first weeks of Donald Trump's second presidency, built through months of diplomatic confrontation, military signaling, and territorial rhetoric, and has now produced something that analysts across the Atlantic describe as the gravest internal crisis in NATO's history. The hospital boat was the latest chapter. But it was one chapter in a story that started much earlier, and one that raises questions far larger than any single social media post. Greenland is not simply a large island in the North Atlantic. Understanding why it has become the focal point of such intense American attention requires understanding what it represents in strategic terms. The territory sits astride what military planners call the Guyuk Gap, the maritime corridor between Greenland, Iceland, and the United Kingdom that controls access between the Arctic Ocean and the North Atlantic. In the Cold War, Greenland was considered one of the most strategically critical pieces of territory on Earth, precisely because missiles traveling between Russia and the United States would arc over it. The United States has maintained a military presence on Greenland continuously since the Second World War, formalized in a defense agreement with Denmark in 1951. That agreement allowed American forces to operate in Greenland under a NATO framework. At the height of the Cold War, roughly 10,000 American military personnel were stationed there. By 2026, that figure had reduced to approximately 150. But the strategic logic that made Greenland valuable in 1951 has not diminished. If anything, climate change has intensified it. As the Arctic ice sheet retreats, new shipping lanes are opening across what was once impassable ocean. The Northwest Passage, long a theoretical route that ice made impossible in practice, is becoming navigable for increasing portions of the year. And Greenland's subsoil holds substantial deposits of rare earth minerals, resources critical to modern electronics and defense technology, in which China currently dominates global supply. Trump has cited both Russian and Chinese naval activity in the Arctic as justification for his position that the United States needs, in his words, complete and total control of Greenland. A January 2025 poll found that 85% of Greenlanders said they did not want to become part of the United States. 3/4 of Americans, according to a CNN poll, said they opposed the United States attempting to take control of Greenland. The view of the population most directly affected by this debate has been consistent and clear. Greenland is not for sale, and Greenland's future, its leaders have stated repeatedly, is for Greenlanders to decide. But what escalated the Greenland situation from a recurring irritant into a genuine crisis was a sequence of events in late December 2025 and early January 2026 that changed how seriously the world took Trump's ambitions. In December 2025, Trump appointed Louisiana Governor Jeff Landry as his special envoy to Greenland. The role was described by observers as informal and explicitly one-sided. Denmark summoned the American ambassador in response. Danish Foreign Minister Lars Løkke Rasmussen called Landry's statements that he would work to make Greenland part of the United States completely unacceptable, insisting that everyone, including the United States, must show respect for the territorial integrity of the Kingdom of Denmark. Then the United States struck Venezuela on January 3, 2026, removing President Nicolas Maduro in a military operation that shocked allied governments across Europe. Within days, Trump intensified his Greenland rhetoric. He refused to rule out the use of military force to acquire the island. He threatened a 25% import tax on goods from EU members unless Denmark ceded the territory. He told reporters it may be a choice whether to preserve NATO or seize Greenland. That framing, the suggestion that an American president was openly weighing the alliance against territorial acquisition, sent a tremor through European capitals. Denmark's Prime Minister Mette Frederiksen stated publicly that if the United States chose to attack another NATO country militarily, then everything stops, including NATO. The Atlantic Council described Trump's pursuit of Greenland as potentially NATO's darkest hour. The alliance rests on the principle, stated in the North Atlantic Treaty's first paragraph, that international disputes are settled by peaceful means and that member states refrain from the threat or use of force. Denmark is a founding member of NATO. It signed NATO's founding treaty in 1949. It lost 44 soldiers in Afghanistan fighting alongside the United States, more casualties per capita than any other NATO member except America itself. Danish Prime Minister Mette Frederiksen's warning was not the expression of panic. It was a precise statement of what NATO's structural logic requires. By mid-January 2026, Trump had threatened tariffs against Denmark, Norway, Sweden, France, Germany, the United Kingdom, the Netherlands, and Finland, 8 nations, all NATO members, stating he would impose a 10% tariff beginning February 1st that would increase to 25% by June unless Denmark agreed to sell Greenland. On January 14th, Danish Foreign Minister Rasmussen, Greenland's Foreign Minister Vivian Motzfeldt, Vice President J.D. Vance and Secretary of State Marco Rubio held what Rasmussen described as a frank but constructive meeting in Washington. The two sides gave different accounts of what had been agreed. Rasmussen said the parties had agreed to explore if a common way forward could be found to address American security concerns regarding Greenland. The White House press secretary said the focus would be technical talks on the acquisition of Greenland. Then, on January 21st at Davos, Trump announced what he described as a framework for a future deal with NATO Secretary General Mark Rutte and said he would not be imposing the February 1st tariffs. He declined to state that the United States had abandoned its claims to the territory. In the weeks that followed, the immediate temperature dropped, but the underlying dispute did not resolve. That was the context on the evening of Saturday, February 21st, 2026, when Trump posted to his Truth Social account the following. Working with the fantastic governor of Louisiana, Jeff Landry, we are going to send a great hospital boat to Greenland to take care of the many people who are sick and not being taken care of there. It's on the way. The post included an illustration of the USNS Mercy, the United States Navy's hospital ship based in San Diego. What made the announcement immediately puzzling to those familiar with the operational status of the U.S. Navy's fleet was what the maritime industry had reported just weeks earlier. As of late January 2026, the USNS Mercy was firmly in dry dock at the Alabama shipyard in Mobile, where it had been undergoing scheduled maintenance since July 2025 under an $18.7 million contract. In January 2026, the Alabama shipyard announced that both the USNS Mercy and its sister ship, the USNS Comfort, were docked alongside each other in Mobile, calling it the first time in 30 years the two vessels had been together, a fact they described as a historic moment. Ship tracking data confirmed both vessels were moored there at the time of Trump's post. The Navy, when asked for comment, referred questions to the White House. The White House did not respond to repeated press inquiries. The Pentagon referred questions to Northern Command. Northern Command referred them to the Navy. No operational details were provided, no timeline was given, no medical need in Greenland had been publicly identified, and no request had been made by Denmark or Greenland for the deployment. The announcement came hours after a separate and unrelated medical event that reporters noted as a possible trigger for Trump's post, though no direct connection was established. On Saturday, Denmark's Joint Arctic Command reported that it had evacuated a crew member from a United States Navy submarine operating in Greenlandic waters, 7 nautical miles off the coast of Nuuk, the capital. The American sailor required urgent medical treatment and was transported by Danish Seahawk helicopter to a hospital in Nuuk, where the Greenlandic health system provided care. The Danish military handled the evacuation, treated the patient, and reported it without incident. It was the kind of routine medevac that happens in these waters. It also demonstrated, as the Maritime Executive noted in its coverage, that Greenland's existing medical infrastructure had promptly and competently provided care to an American sailor. Greenland Prime Minister Jens Frederik Nielsen responded to Trump's announcement the following day on Sunday, February 22nd. His statement was direct and measured. He said the announcement had been noted, but he said Greenland had a public healthcare system where treatment is free for citizens. He described that as a deliberate choice and a fundamental part of their society. He contrasted it explicitly with the United States, where going to the doctor costs money. He said Greenland remained open to dialogue and cooperation with the United States. And then he added a line that captured the accumulated frustration of months of unsolicited declarations arriving via social media. Please talk to us, instead of just making more or less random outbursts on social media. Danish Defence Minister Troels Lund Poulsen confirmed to Danish public broadcaster DR that Danish authorities had not been informed that the ship was on its way. He stated that the Greenlandic population receives the healthcare it needs, either in Greenland or for specialised treatment in Denmark, and said it was not as if there is a need for a special healthcare initiative in Greenland. Danish Prime Minister Mette Frederiksen posted on Facebook that she was happy to live in a country where access to healthcare is free and equal for all, adding that Greenland shared that same approach. Greenlandic politician Aja Chemnitz, one of two Greenlandic members of the Danish Parliament, wrote on social media that Donald Trump wants to send a poorly maintained hospital ship to Greenland, and that it seemed rather desperate, adding that such a gesture would not contribute to the permanent and sustainable strengthening of the healthcare system that Greenland actually needs. Jeff Landry, the special envoy, pushed back on the Prime Minister's response, writing on X that America is committed to defending Greenland, and that this begins by ensuring its people are defended against basic illnesses. He wrote with evident frustration, shame on Prime Minister Jens Frederik Nielsen. He said he had spoken to many Greenlanders about the problems they face, and that healthcare was one issue that stood out. Now, the fact that Greenland and Denmark rejected the offer with a no thank you does not mean that Greenland's healthcare system is without genuine challenges. Those challenges are real, documented, and distinct from the framing the announcement implied. With 57,000 people spread across the world's largest island, roughly the size of Western Europe, healthcare delivery in Greenland faces structural challenges that no hospital ship could address, and that experts emphasize require sustained systemic investment rather than ad hoc interventions. There are 5 regional hospitals across Greenland and a national hospital at Queen Ingrid's in Nuuk. For residents of remote settlements, those hospitals can be several hours away by plane, helicopter, or boat. There is no road network connecting Greenland's communities. Some villages have fewer than 200 residents, others have fewer than 50. Medical offices in some remote settlements have stood empty for months at a time due to staff shortages. Life expectancy in Greenland is 69.6 years for men and 73.5 for women, substantially lower than in Denmark, where people live on average 10 years longer. Research published in peer-reviewed medical literature documents that Greenland faces grave challenges in the recruitment and retention of health workers. High staff turnover overloads permanent staff. Communication between patients and healthcare workers is complicated by the fact that many Greenlanders, particularly outside Nuuk, primarily speak Kalaallisut, the indigenous language, while most healthcare workers speak Danish. A 2025 GE healthcare analysis noted that Queen Ingrid's Hospital in Nuuk for years operated with outdated medical imaging equipment, and that patients requiring advanced care had to be flown to Copenhagen. Greenland's Minister of Health has publicly acknowledged a significant backlog in the healthcare system, estimated at approximately 1 billion Danish kroner, roughly $158 million. Aja Chemnitz, the Greenlandic parliamentarian, noted she had campaigned for closer healthcare cooperation with Denmark and succeeded in allocating 35 million Danish kroner annually, with an additional 185 million allocated this year for treatment of Greenlanders in Denmark. These figures represent genuine incremental progress on real problems. What they do not represent is a medical emergency requiring the urgent deployment of a US Navy vessel whose operational readiness was in question. The question of what the hospital ship offer actually signified, as distinct from what it stated, is one that analysts and observers have noted sits at the center of the entire Greenland story. The stated reason for the offer was humanitarian. The United States wanted to help sick Greenlanders who were, as Trump put it, not being taken care of. But that characterization was factually contested by the governments most directly responsible for Greenland's care, neither of which had requested assistance, and one of which had just provided competent emergency care to an American service member hours before the announcement. The image Trump posted alongside the announcement was, according to the Washington Post, what appeared to be an AI-generated illustration. The ship it depicted was currently in dry dock. No operational plan was provided. No specific patients were identified. No medical need was formally documented. And neither Greenland's government nor Denmark's was consulted before the announcement. What the offer did accomplish, whatever its intent, was to keep the Greenland issue in the global news cycle at a moment when the immediate tariff threat had subsided and the Davos framework had briefly reduced the temperature. It maintained the narrative, established over months, that Greenland's population is in some way being failed by its existing governance, and that the United States has a role to play in addressing that failure. That narrative is contested by the people it purports to serve. When one resident of Greenland was asked by CNN about the prospect of American governance, he cited the privatization of healthcare as his primary concern. The irony of a country where seeing a doctor comes at a cost, as Nielsen stated explicitly, offering to send a medical ship to a country where healthcare is free, was not lost on commentators across Europe or Greenland. One observation worth noting from the maritime executive's analysis was this: the USNS Mercy would be deployed from Alabama, a state where more than 400,000 residents lack health insurance coverage. What should we make then of the full sequence of events that this hospital ship episode is embedded in? It is worth stating clearly what is known, what is not known, and what the available evidence allows us to assess. What is known is that President Trump has, since the beginning of his second term, repeatedly stated his desire for the United States to acquire Greenland. He has not ruled out military force. He has threatened tariffs against NATO allies who conducted military exercises in Greenland. He appointed a special envoy whose stated purpose is to achieve American acquisition of the territory. He struck Venezuela in January 2026, demonstrating a willingness to use military force unilaterally in ways that had lasting consequences for international perception of American intentions. He announced in January that he had reached a framework on Greenland with NATO's Secretary General, but declined to state that American acquisition claims had been dropped. And he announced the deployment of a hospital ship without consulting Greenland or Denmark, without providing operational details, and at a moment when both US hospital ships were in dry dock undergoing maintenance. What is not known is whether any actual deployment will occur, what specific operational plan exists if one does, and what the long-term trajectory of US policy toward Greenland will be following the USMCA review, the ongoing Venezuela situation, and the continuing negotiations within NATO. What the evidence allows us to assess is that this episode, like the others before it, is not occurring in isolation. It is occurring within a sustained pattern of American pressure on Greenland that has produced the most significant internal crisis in NATO's history. The hospital ship offer was not simply an unusual diplomatic gesture. It was the latest move in a campaign whose stakes, measured in terms of alliance cohesion, international law, and the self-determination of 57,000 people, are far larger than any single social media post can contain. Greenland's Prime Minister made clear in his response that his government is open to dialogue and cooperation with the United States. He has said that consistently, even as the pressure has intensified. Denmark has invested billions of additional kroner in Arctic defense, not as a confrontation with Washington, but as a demonstration of commitment to the territory it governs. The Nordic Council's documentation of Greenland's healthcare system makes clear that the challenges are structural, geographic, and require sustained investment, not symbolic interventions. The question at the center of this story, the one we began with, was what the United States actually wants from Greenland and how far it is prepared to go to get it. The hospital ship answer to that question is this: what has been made clear through months of documented escalation, from threats to tariffs to military allusions to social media announcements of unasked-for medical deployments, is that the United States under the current administration views Greenland not as a partner in dialogue, but as a strategic acquisition to be pursued. The people of Greenland have expressed by an 85% margin in polling that they do not wish to become part of the United States. Their Prime Minister has said it clearly, calmly, and repeatedly. The debate now is not about whether Greenlanders want American governance. That question has an answer. The debate is about whether that answer will be heard, and by a world watching closely, whether the values that held the Western alliance together for 75 years will prove durable enough to survive this moment.